The U.S. Environmental Protection Agency issued new rules today which set limits on certain forever chemicals in drinking water for the first time ever. Advocates believe it will protect people's health, but note water systems in West Michigan will likely not be as affected by those standards.
A monumental victory.
It's been swept under the rug and pushed aside for far too long. And so impacted communities across the region and across the country are celebrating this. It's a real milestone event.
That's how Tony Spinola, who co-chairs the Great Lakes PFAS Action Network, describes a rule that, for the first time, creates a national drinking water standard for 6 forever chemicals.
And we're seeing things like kidney cancer, thyroid disease and thyroid cancer, testicular cancer, ulcerative colitis, high cholesterol, and developmental issues in young and developing children.
Commonly called PFAS, he explains the hard-to-break-down contaminants used since the 1940s in industry and consumer products like nonstick cookware and waterproof clothing cause severe health problems, even at low levels of exposure to them. Under the new standard, providers must show less than 4 parts per trillion of PFOA and PFOS chemicals in drinking water samples and no more than 10 parts per trillion for 4 others. It also establishes a maximum contaminant level for any mixture of the PFAS identified.
Generally speaking, the EPA standards are lower than the Michigan standards. Not by a lot for certain of the chemicals, by a lot for a couple of them.
Spinola says the rule falls below standards adopted by the state's Department of Environment, Great Lakes and Energy in 2020, but believes because Michigan communities already test and treat forever chemicals, it may not be a big deal.
If you're testing and you're finding these chemicals in your water systems and you're treating, the treatment should take the levels down below even the EPA levels. So that's the good news for Michigan. But there are chemicals that they set way lower standards for. A chemical called Gen X, a chemical called PFH excess. We're talking at quite a bit lower levels than what we see under the Michigan standards.
He adds towns that get their water from the Big Lake find themselves in a better position too, since it's more common to find PFAS in inland waterways. In a statement to Fox 17, the city of Grand Rapids said it does not expect to be impacted by the rule. Federal officials expect it to cost $1.5 billion annually to implement and plan to provide $9 billion from the bipartisan infrastructure law to address contamination, including $1 billion to conduct initial samples and mitigation, although the standard does not dictate how that should be done.
I think there's going to be a lot of work between the EPA and states and localities as this rule is implemented. I think the first step is really understanding what the levels are in water systems around the country, and then taking steps. I think there's a number of water treatment technologies available, and EPA will work where that mitigation is needed.
Spinola calls it a worthwhile investment.
It's a tough problem, but an ounce of prevention is worth a pound of cure, and I just hate to see young children and pregnant women drinking this water and potentially poisoning their children for decades to come.
The EPA estimates between 6 and 10% of public water systems across the country will be subject to this rule. They must complete their initial test by 2027 and post their results to the public by 2029. The agency says systems need to implement solutions that reduce the PFAS if they find excessive levels. Reporting in the studio, Marisa Oberle, Fox 17 News.